pleased and honored to be here. I don't have any slides for you, but I have 4 major points to communicate in the next 8 minutes. First point is, many of you may not be familiar with what nutrition is, so I want to just briefly tell you a bit about what nutrition is and how it arises. Second, I want to tell you about the impacts of the crisis and the response to the crisis on hunger and nutrition. Third, I want to talk about some of the things that we should be doing to mitigate that impact. And fourth, I want to have a sort of a footnote or an end note about the role of the legacy of this crisis and how the legacy will be carried via very young children throughout their lives and to next generations if we don't do something about it. So first of all, malnutrition, the opposite of good nutrition, comes in many forms. Sometimes it comes in the forms of UNICEF adverts and Save the Children adverts, where you see very thin children, skin and bone. They look like they're about to die, and very often they are about to die. But it can also come in different guises. It can come in forms that you can't see very easily. Micronutrient malnutrition, not enough zinc, iron, vitamin A, vitamin D, vitamin C. You don't look terribly different until it's very critical. And then, of course, there's things like obesity, overweight, and diet-related diseases, hypertension, and diabetes type 2. All of these different types of malnutrition are driven by an interaction of poor quality diet. You're either not getting enough food, you're not getting enough of the right kind of food, or you're consuming too much of the wrong kind of food, and an interaction with a poor health environment. You're not getting access to healthcare, you're living in an environment where you can't get clean water, there's sanitation, open sewers are everywhere. So it's this interaction of poor health environment and poor food environment. It's a very serious condition. 1 in 3 people worldwide are malnourished. It's the #1 driver of the global burden of disease, poor diet. So the #1 driver of the global burden of disease, and the economic consequences and the cognitive consequences are far-reaching. So what's the impact of the crisis and the response to the crisis on these things? Well, we think there are 3 pathways. It's pretty obvious what they are. The first one is just a massive collapse in income. The World Bank estimates 5%. I've seen 10% estimates, drops in GDP per capita. And of course, those percentage drops will be bigger for poorer people than they will for people like us on this call. They will lose their jobs. They already spend 50% of their money on food. The price of food will be going up, skyrocketing, especially for fresh foods. So the first thing is income. If people don't have enough income, they can't buy the right kinds of foods or enough food, and they can't get access to healthcare, clean water, and sanitation. Second thing is, unlike the food price crisis of 2008, where it was essentially drought, biofuels, the price of oil, sort of making it really hard to produce enough food, the response to the crisis has sort of decimated the whole food system. Everything from input markets, output markets, processing, transport, storage, marketing, retailing, everything has been disrupted. And so that means the supply of food from where it's grown to where it needs to be consumed is completely uneven. You see piles of rotting, perishable food in one place and shortages of perishable food in other places with skyrocketing prices. The third way, and that's obviously very bad for malnutrition, the third way malnutrition is being affected is through the inability of the health system primarily to deliver essential nutrition programs, immunization, antenatal care, supplements through prenatal visits, vitamin A supplementation, fortification of key foods, breastfeeding promotion. These kinds of programs are being decimated again. The coverage is being lost because the health system is so focused on the COVID-19 crisis. So these 3 things together are generating massive impacts. The World Food Programme estimates an extra 135 million people will be plunged into acute hunger this year. The World Bank and various other estimates of poverty, extreme poverty, are, as Jean-Marc said, about 50 million from the World Bank, 130 million, 150 million from UNU wider, and there's a bunch of estimates in between. And $1.9 a day is extremely poor, and people on $1.9 a day are typically hungry or malnourished. So it's going to be a very big impact. The estimates I've seen on stunting and wasting, these are things that affect kids under the age of 5. It literally transforms the way their bodies look. They're either too thin or they're too short, and those are important markers for immune system response being devastated, and for cognitive development also being devastated. I've seen estimates of those going up, wasting going from 40 million kids to 50 million kids, and from stunting going from 145 million kids to 160 million kids. This is just in the last 3 to 6 months. So big impacts. And what you have is you have malnutrition, kind of existing malnutrition supercharging the virus, because malnourished people are more prone to infection of all types, including coronavirus. So that's not good. You've got diabetics, those with hypertension, those with other kinds of chronic diet-related diseases, also suffering higher severity once they've caught it due to comorbidities. So you've got pre-existing malnutrition supercharging the impacts of the virus, and then you've got the response to the virus supercharging the malnutrition. So you've got malnutrition, the virus and its response, and more malnutrition. So you've got this massive inequality machine that's being driven by malnutrition. So what to do about it is my third point. Well, the first thing to do about it is to alert policymakers and the multilateral system, the bilateral system, the governments, that if you don't deal with the food system, you are going to win the health system battle, but you are going to lose the food system battle. And when you lose the food system battle, there is literally rioting in the streets, and it's a massive security issue. So you have to somehow strike a balance of fighting on not 2 fronts, but 3 fronts. Most governments are trying to fight the health system battle, the economic battle, but they also need to fight the food battle. And luckily, the food and the economic battles they overlap, but not entirely. So in the health system, don't let all your resources get sucked into COVID-19. Don't forget about doing the basics, the fundamentals, immunization, promoting breastfeeding. These are really important programs that need to continue even in the midst of COVID-19. Second thing, you need to keep your food markets open. You need to keep them working. If you don't, food is going to rot in one place and be scarce in another place. On average, you'll be fine. But of course, you know, people with their heads in the oven and their feet in the refrigerator are also fine on average, but of course they're in lots of pain. So averages don't work here. You need to make sure that food is getting from where it's grown to where it needs to be consumed. And that means supporting small and medium enterprises that make and move and process most of the food in low and middle income countries. It means keeping essential workers in the food system healthy and well-fed and working. And it means keeping markets, especially wet markets, open, because very often wet markets are closed due to food safety scares and infection and lack of protocols and lack of protective personal equipment. We need to keep the markets open, keep the SMEs going, and keep the food system workers healthy. And the third thing we need to do is to keep social protection programs going. Billions are being spent on social protection, often cash transfers. What can we do to link the cash transfers to the production and consumption of nutritious foods? So this is the third thing that we need to do. And the fourth thing, and I'll finish up now, Jean-Marc, is again, keep food and nutrition, keep SDG 2 in the headlines. Who'd want to be a politician at a time like this? Who'd want to be a business leader at a time like this? But you know what? This is what this moment is defined for leadership. So this is the moment where people have to lead, and they have to come together, and they have to be able to fight battles on more than one front. And we need to help them do that. We need to give them the right information, the right arguments, and the right advice on what to do and when to do it. My final point is about children. I've heard a lot about we need to, every crisis is an opportunity. The Chinese symbol for crisis is threat and an opportunity, and that's absolutely right. And so there's a lot of talk about bouncing back better, building back better, and all that sort of stuff. And that's really, really important. But for very young children under the age of 2, they can't bounce back better. If they are damaged by this crisis and the response to the crisis under the age of 2, a lot of the systems that they're building, think of wet concrete that is hardening. Any impression on that wet concrete is there forever. And so if those immune systems, if those cognitive development functions are damaged in this 2-year period by COVID and by the response to COVID, that will last forever. That will be a legacy that those children will take forever, and they will pass it down to their children, because we know malnourished people are more likely to give birth to malnourished children. So that's the legacy that we have to deny this crisis. We have to put very young children first and protect them first. And if we do that, that can be our legacy.